talk about treating PIP joint stiffness, I want to be sure that we're very clear as to the cause of the stiffness. This presentation does not allow us to go in depth about all causes of PIP joint stiffness and its treatment, but we should have the skills to determine the cause because that will determine the treatment. Which is the limiting factor for PIP joint movement? Is it truly tightness around the joint, meaning is it capsular? Is the joint itself? Is there interosseous muscle tightness, which can be a significant factor in limiting particularly PIP joint flexion? Is there extrinsic flexor or extensor tightness of the muscle tendon units? Or is there perhaps adherence somewhere along the tendon root of either the extensor or flexor? Any of these things can limit full PIP joint motion. Let's just take a brief look. Joint tightness of the PIP joint would provide restrictions to joint movement regardless of the position of proximal joints. In this illustration, the wrist is neutral and the MP joint is extended and the range is checked. Here the wrist is brought into extension and the range is checked. We would then subsequently also move the MP joint and see if it changed the position of the PIP joint. If the range of motion of the joint is the same, regardless of the position of the other joints, you are able to say that the PIP joint capsule is tight. However, it is not uncommon clinically that there are tight capsular structures or adherence around the capsule, and there are other factors at play. So it's often not as easy to sort this out because it's only easy to sort out if there's only one problem. Interosseous muscle tightness, in my opinion, is one of the most frequently missed causes of continuing limitation of interphalangeal joint flexion. This is a very complex subject. I have dealt with it in depth in other presentations, and therefore I would like for it to suffice that if you do not understand interosseous muscle tightness or how to evaluate for it, that is an area where I would encourage you to spend some time and focus. Interosseous muscles are tested comparing the ability to passively flex the PIP joint while the MP joint is flexed, and then bringing it into extension as in this illustration and testing passive PIP joint flexion. If passive PIP joint flexion is less when the MP joint is extended, interosseous muscle tightness is present. If interosseous muscle tightness is present and you only focus on the PIP joint to regain motion, you'll be defeated in regaining full range of motion. Extrinsic tightness of the muscle tendon unit is fairly easy to evaluate. You extend all proximal joints, for example, here the wrist and the MP, and then test to see if the interphalangeal joints will extend. They're able to extend when the wrist is flexed, no problem. Therefore, you can say that there's tightness of the extrinsic flexors. The same is true of the extensors. Perhaps the hand can extend like this, but when the MP joints are fully flexed and or the wrist is flexed, there's resistance to full flexion. Again, if you only treat the PIP joint and you don't treat this additional extrinsic tightness, you will not be able to regain the full range of motion. Evaluating adherence of an extensor or flexor is somewhat more difficult because the tendon can be adherent anywhere along its path. Therefore, the joints proximal to the point of adherence are not going to affect the tension. Let's take an example. Let's imagine that there's been a laceration of an extensor digitorum communis tendon here over the dorsum of this hand. And with the MP joint extended, there's no problem flexing the PIP and, if you will, the DIP joint. But holding the wrist in the same position, now flexing the MP joint, we've now put tension on this adherence. It will not glide distally as we would like for it to. So now when we try to flex the finger, there's significant resistance. Clinical experience will assist you in being able to localize this adherence. The same would be true of the flexors. But the important point here is to know that adherence versus muscle tendon unit tightness can be a limiting factor. In an effort to sort out the mysteries of the multiple factors that can limit motion, I would encourage you to go to our website. There are a number of short articles written to explain some of the aspects of these evaluations, as well as some other factors. In our clinical pearls section, there are also articles that have been published, and there are a few chapters that are relevant to this PIP joint management as well. All of these are free of charge and freely accessible to anyone.